afternoon. Today, Thursday. Today, we're going to talk about WTF. What the fat? It's a very common question. It's a very common problem. Constantly, every day, I get asked this question. There's a lot of confusion between fat and weight. So today I'm going to tell and talk to you all about, at least inform you all on the difference between fat and weight. Okay, so I have some slides here. I'm going to show the slides and then we can, to make you all understand better. Some people are overweight, some people are not overweight but have excess fat. So if first and foremost, you have to decide whether, or you have to find out whether you are overweight or not. Then there is a calculation for that. Then if you feel you have extra fat, which type of fat do you have? Is it, there are three types of fat in the body. There's the visceral fat, there's the subcutaneous fat, which is fat under your skin. Okay, if you pinch yourself, you can pinch the fat. And then there is the essential fat, which is the fat that circulates in the body. So here I have a model that shows us, this is a cross section of our abdomen, our tummy. Okay, there's so if you have a cross section, you look inside our tummy, what you can see, there's the back. This is the subcutaneous fat, and then we have the intestines, the muscles. After the muscle is another layer of fat, which is around the organ. And this is what we call the visceral fat. So visceral fat is fat around the organ. And if you look from above, you cut across above, you can see fat under the skin, which is subcutaneous fat, and then muscles, and then fat around the organs, which is the visceral fat. Now, the difference between subcutaneous and visceral fat is that subcutaneous fat is not very nice cosmetically because you can look fat, but doesn't harm you that much. But the visceral fat is the one that causes a lot of physical problem, metabolic problem like heart disease, high blood pressure, diabetes. Okay, so when we do cosmetic procedures, we actually are tackling only the subcutaneous fat, the fat under the skin. Yeah, basically the fat that you can pinch. So if you go to your tummy and you pinch your tummy, you get about 2 inches of fat. That is actually the subcutaneous fat. Some people who are normal weight can have quite a lot of subcutaneous fat, not much subcutaneous fat, but can still have the visceral fat. Whereas there are people who are also considered overweight. And so how do you measure? Now the calculation we use is BMI. Ataupun body mass index. Yeah. So you need to do a normal BMI in order to be so-called in a healthy range. So kalau what we normally do is to calculate the BMI. It is actually for your BMI. Here I've got your BMI range, right? And to measure BMI, it is your height, your weight against your height squared, and that's how you get your BMI. So for a normal BMI, you want to be at 23 for women and 25 for men. Okay, so any BMI that's above this is considered overweight, and therefore you have more risk of getting diseases. So you want to be a BMI of below 25, not too high up. Now, when your BMI is up above 25 or 27, you're considered overweight. Okay, there's a score here. This is a score, and normally if you come to the clinic, we calculate from. There's a chart here that we calculate based on your height and your weight, and then we get your BMI. And if your BMI is above 27, it is highly recommended you try and lose your weight. And usually you would have a combination of fat under the skin, subcutaneous fat, as well as fat between your around your organs. Okay? Kalau your BMI is normal, then you don't have to worry. You can just do, you can maintain your lifestyle and then keep your fat under the skin, treat your fat under the skin. Okay, I wanted to tell you about some treatments that we have that is ideal for fat under for being overweight as well as for fat under the skin. Kalau overweight, of course, the standard practice of good diet, healthy eating, exercise regularly, do not overeat, that one still falls true lah. So you have to follow that. But for those who want to lose fat under the skin, there are a few methods available, and these methods can be invasive or non-invasive. Of course, what's popular now is the non-invasive treatments. So non-invasive can be anything from radiofrequency, where we heat the fat and then make the fat melt, to freezing, cryolipolysis, where we freeze the fat and make the fat die, the fat cells die, a process called cryolipolysis or apoptosis, where the cell death occur. Or also we can do a laser, where we can go in and actually melt the fat under the skin with the laser. And then after that, once the fat is melted, it will then be dissolved and absorbed by the body. Okay, so all these procedures are available. You can do it, but make sure you do it with the right people and the right trained personnel. And you can go to your doctor or to your clinician and measure your weight, see what you need to get rid of and what would be ideal for you. Okay, tummy fat, it depends. If it's a visceral fat, which means fat inside the tummy, abdomen, then you have to, the only way is to increase exercise, to move. So you need to exercise and move about, do a lot of kinetic and moving exercise, because that will get the circulation going, and so the visceral fat will reduce. If you want to get rid of your fat under the skin, which is kinetic fat, then you need to do more static exercise like weights, right? So say for example you want to get rid of the fat in your arms, so you need to do more arm weights so that the muscle contract and burn the fat around that area. If you want to get rid of the tummy fat, then you need to do tummy contraction, whereby you do sit-ups or you do weights around the tummy so that the abdominal muscles contract and then burns the fat around there, and so then you can form more muscle. So localized fat is best done with exercises that is localized, whereas visceral fat we should do with moving exercises like cycling and running. Okay, that is naturally at home what you can do. Of course, there is food, there's the diet, there's a hormone that we need to take care of in order for your tummy not to grow big. If you come to me, and then we'll do some treatments, and that treatment will be depending on what you would like to do and what you're open to, as well as how invasive or not invasive, as well as pain or no pain, and what sort of technique you want. So we could do cryolipolysis, we could do cool sculpting, we could do radiofrequency will vanquish, we could also do the laser lipolysis, where we actually melt the fat to take it out. Cool sculpting to freeze the fat, vanquish to melt the fat with heat, laser lipo to melt the fat with laser, as well as a procedure called air sculpting, where we use air to melt the fat. Everybody is born with the same number of fat from the day they're born until they die. Okay, we believe that we're all born with a certain number of fat, and then we die with that same fat. Now, what happens as we age is that if we eat more, fat is a storage organ, right? So as you eat more, your fat is going to engorge and get bigger. When you fast or you eat less and you burn or you exercise, then your fat is going to shrink up, right? So fat or thin is because of your fat increasing or reducing. Okay, now, so when you're thin, you still have the same number of fat. It doesn't get less, it's just smaller, right? If you want to permanently get rid of fat, sometimes the body has got a tendency to accumulate fat in certain parts, like the waist or the tummy or the arms. And this is genetic, because depending on what your parents, what you sort of inherit, then you have the gene where the receptors tend to accumulate fat in certain parts. So if you look at your mom or your aunties on your father's side, your relatives, your female relatives or your male relatives, there's a tendency for them to have a certain body shape. That's because they have the receptors in those parts. So you just get a little bit more and you have fat in those parts. Now, in order to get rid of that, sometimes you can't exercise. No matter how much exercise you do, it sticks there. So one way is actually to target this fat, and in order to get rid of it permanently, no matter how much diet you do, no matter how much weight you lose, no matter how much you exercise, it's still there. And in women, usually it is the saddlebags, the outer thigh. Now that's where intervention comes in. That's where the medical procedures come in, where we go in and we break the capsule of the fat and then permanently damage it, and then hopefully it doesn't come back. Okay, so the difference between weight loss and fat loss would be weight loss is overall weight, and you want to keep within your BMI, the right BMI, which is 23 or 25 for men. That is ideal. This consists of weight, consists of your organs, your fluid in the body, your muscles, the fat inside, outside, as well as your essential fat. So that's overall weight loss, and so you want it to be within this range. Then there is fat loss, which is actually the fat in your body, either visceral fat or the under the skin, and then you want to get rid of this. It could be localized in specific areas, because these areas are those that you do not want, and that's where treatments come in. So you could be of normal weight and yet need fat loss, or you could be overweight and want to have weight loss. If it's a permanent fat reduction or permanent fat treatment, it should not come back. So I wanted to show you how the fats look like, and then once we destroy the capsule of the fat, it actually doesn't come back. It depends on your activity level, because roughly each individual would need 1,500 to 2,000 calories a day. That would come from proteins, nutrients, and other nutrients, as well as fat. And then depends on your age, your activity level, that would determine how much fat you can eat. Yeah, there are certain diets as well out there that make you eat a lot of fat and no carbs at all, like the keto diet. So it depends. Okay, I think for now, that's all. We're gonna go and then meet you again next week on next Thursday at same time, and we'll have another topic to talk about. Bye.